Welcome, everybody, to the Cone of Shame Veterinary Podcast. I am your host, DrAndyRoark. Guys, I am here with veterinary behaviorist Dr. Chris Pachel, and we are talking about actually getting behavior appointments done in vet practice. Look, we all know that doing behavior in our appointments is important. Pet owners are interested in behavior, and they have tons of behavior questions and challenges. And if you've done any work in behavior, you know that it takes time. It is not a magic wand. It is a process of working with people and giving them our time and focus and attention. And guys, a lot of us are short-handed. A lot of us are really busy. Oftentimes people bring their pets in for one thing and then, oh, surprise, here's a big behavior issue right on top of it. And I expect you to deal with both of them in this 20-minute appointment that we have. We get into making behavior happen in our practices in a way that makes sense. Chris does a great job of sort of breaking this down. We talk a little bit about AI at the end of the episode and how that is going to interface possibly with behavior and behavior visits. This is going to be a good one. Let's get into it.
This is your show. We're glad you're here. We want to help you in your veterinary career. Welcome to the Cone of Shame with Dr. DrAndyRoark.
Welcome to the podcast, Dr. Christopher Pachel. How are you?
I am doing fantastic, Andy. Thanks for having me on.
I always enjoy having you on. I'm glad you made it. For those who don't know you, you are a veterinary behaviorist in Portland, Oregon. You're a busy guy. You have a lot of things going on. A couple of the things I will pull from the pile are you were at the Animal Behavior Clinic. You were also at Instinct Dog Training. You have done a number of podcasts with me. You were lecturing. You were very, very busy. And so I appreciate you making time for me.
No, absolutely. The opportunity like this to really have a conversation with someone like yourself, to get into some of these meaty topics that we can cover in these little bite-sized snippets. Man, I'll make time for that in my schedule every day.
I always appreciate your perspective. I think you do a really good job. You're a thinker. You are philosophic in your views. And then also you take that philosophy and you translate it into very pragmatic action steps of what people can do or what we can say or how conversations can go smoothly. And so I love to think about the implications of things and then, okay, what are we going to do about it? And I think you do that really well. And so that's what I want to kind of come to you today with. I want to talk to you about behavior, animal behavior training in veterinary practices. I love having you on the podcast. You and I have talked through a number of different cases at this point. I will tell you, when I am out in the world, and I'm sure other people in the vet profession will agree to this, the number one thing I get asked about, when people are like, hey, can I ask you a question? Behavior is number one. How do I get my pet to stop doing this? Jumping up on the countertop, stealing food, barking at the window, yanking me down when we go for walks. It's the percentage of behavior. It's probably 50-50 behavior and everything else. Really. And people, they want to talk about their pets. They want to get into behavior. Where the rubber meets the road in practice is, we have 20-minute appointments often. And we are shorthanded. There's a labor shortage. We are trying to go fast and get things done. And so there's great demand for behavior and behavior services from the pet owners. We also know that keeping pets out of shelter oftentimes depends on, having some behavior services and helping them. And at the same time, I think a lot of veterinarians and vet professionals wonder, do we have time to have these conversations? How do we do this? It seems like it's challenging to bill for. Clients want to come in and have an appointment, and they want to talk to us for an hour and a half, but they don't want to pay for an hour and a half of veterinarian time. And so anyway, I just kind of just dumped a lot on you here. Chris, can you just speak at a high level? Do you see this stress as someone in the veterinary behavior world? Do you see the conflict between vets trying to support people and then also, let's be honest, some challenging logistics in getting behavior done in the way we were taught in vet school that behavior needs to be done?
Yeah, it's absolutely one of the most common questions that I get when I am lecturing at veterinary conferences or I'm doing vet-to-vet consults with practitioners who are trying to get advice on how to handle a particular case. There's that sort of that underlying theme of, but how do I actually put this information into common practice? It's going to take me forever. I can't block my schedule. I can make way more revenue for myself and my team if I'm doing dentistry procedures or surgeries or other diagnostics. And so how do I how do I do that? And I think sometimes if it's still appropriate to say, throw the baby out with the bathwater to some degree, right? Where we're trying to say, gosh, if I can't do a 2-hour behavior consult, then I just can't do behavior.
Yeah.
And, in some ways, I think about it almost the same way as saying, you know what, I was in general practice for a number of years. I didn't do a TPLO myself. I didn't do total hip replacements. I didn't do intradermal allergy testing of dogs. There were a lot of advanced procedures that I didn't do, but I still had to have a basic understanding of when and if those procedures were appropriate, how to talk to a client about how to choose between their available options. And even from the standpoint of saying, if I, saw that dog, let's say it's a hind limb lameness, for example, cruciate until proven otherwise, sort of an idea, and I don't have time to evaluate that dog today. It's not an acute injury. I can say, cool, we're going to schedule you to come back on Tuesday. It's going to take about 2 hours for the sedation and the radiographs. We do it all the time where we delay the diagnostic or the conversation until we have a window to actually perform the service. And I think sometimes one of the easiest things to do if we have an interest in really diving into that conversation is say, that's a great question. It's going to take more time than I have available, so let's see you back on Tuesday. Let's do it. It'll take us about an hour to run through the details. I'll have some questions. I'll share my perspective. We can troubleshoot and figure out what's the best option for going forward. I'll see you at 9 a.m. We can do that in that little snippet that we have at the end of an appointment and still provide that service for the client.
I tell a story sometimes. I went to a physical therapist one time because my foot was bothering me, but also my shoulder was bothering me because I am a master's athlete. So I go in and the person's like, great, you're here for your foot. And I was like, yeah, my shoulder also hurts. And she just didn't miss a beat. And she said, which one do you want to work on today? And I thought, wow, you can do that. You can just ask which one of these do you want to do? And so I picked one, but I've always remembered that in the vet world, I've been like, oh, well, we better go fast then. And that just did not seem to cross her mind. She was like, no, what's the focus for today? And we can work on the other one next week or make another appointment. And when you say that, it's so funny. I think a lot of us don't really feel like we have permission to just punt somebody till later in the week.
Yes. And what I love about that is for that individual who responded in that way to you, they heard your concern and they provided you with a solution and the power of choice and agency to choose your own adventure.
It was really well done. It was so casual too. It wasn't like, hey, look, I'm really sorry about this. It was just, great. Which one? I do think that there's a lot to that. I think that feeling empowered to say, this is going to take, I really like the wording that you use. This is going to take more time than what we have for today. Let's get back in. It's probably going to take about an hour, but let's really go through this. I think that you can communicate real value there. I think that the doctor says to you, I want to spend enough time with you to really get this problem worked out. And I would not be helping you if I don't give you that amount of time. I think it makes them feel seen and taken seriously. And I suspect it conveys value to them. I really like that a lot. I'm a big advocate for technician and technician utilization. I think we can use our technicians more than we do. What I see in technicians and support staff really is a desire to learn and develop. Not everybody, but there's a hunger for knowledge and to be valuable and useful to the pets and the pet owners. And so I look at this and I wonder about technician and support staff utilization in these cases. Now, I know that there's different degrees where we have, some behavioral cases may be pretty complicated. They may have medical components wrapped into them, things like that. But the vast majority of behavioral questions that we get about, litter boxes, things like that, I feel like that's things that can be delegated, whether it's done by the technician in the appointment or whether we allow technicians to have technician appointments to address things like this. I know I'm starting to see a move in our profession towards more technician appointments, more technicians working independently. What do you think of when you hear that, Chris? Do you think that things like that are possible? Have you seen technicians taking the lead on behavior cases in practices in a way that makes sense?
Absolutely. And especially in the general practice setting around behavior, the ability to go in and to learn how and to practice taking a good history where we can ask those questions where, let's say it's the cat that's eliminating outside of the litter box. There's a list of pretty standard questions that we should know the answers to before we recommend a particular treatment. Simply saying, oh, your cat's peeing outside the box, add a box, or try a different litter. It's sort of like saying, oh, I've got a cat who's peeing excessively. Here's some insulin. Try that first. We would never do that. We need the diagnostic information to actually know what the solution to the identified problem is, even at a working diagnosis level. And a technician who's been trained in that area, who has a foundational knowledge in behavior, can do a lot of that heavy lifting. And in some of those cases, do all of the lifting to really help those clients understand, again, is this something that needs to be approached from a medical side of things? And, maybe they get that history for that cat who's peeing outside the box. And in asking some of the routine questions, we also identify the fact that the cat is not jumping up on the furniture the way that it used to. And it's a 9-year-old, and this is a new onset problem. And awesome, that cat likely needs to be evaluated by the veterinary team, and there's probably some diagnostics. Awesome. That didn't necessarily need the veterinarian to spend 20 minutes gathering the history to be able to determine that that's the next step. The technician is going to be able to say, okay, I can identify what is quote unquote behavior only and what needs the veterinary lens. Go for it.
I really like that idea of the history leading into the conversations that we want to have, and having my technicians trained so that they have the history, and then I don't want to make it into an algorithm necessarily, but if the answer to this question is yes, then this is kind of the path that we start to go down.
Looking to protect your canine patients against parasites? Look no further than Simparica Trio, Serraline Moxidectin and Pyrantel chewable tablets. The first chewable to offer triple protection from heartworm disease, ticks and fleas, and roundworms and hookworms. It's also FDA approved to block infections that may cause Lyme disease by killing deer ticks.
Use with caution in dogs with a history of seizures. Serraline belongs to the isoxazoline class, which has been associated with neurologic adverse reactions. The most common side effects were vomiting and diarrhea.
Visit SimparicaTrioDVM.com for full prescribing information.
Do you have favorite training resources? So, I think a lot of times we throw our assistants and our technicians kind of into the room and we're like, here's the history. Ask anything that's weird, just ask them more questions. How do you get your staff up to the point where they can have these conversations? I'll be honest with you, I've seen a lot of practices where everybody's kind of freestyling, you know what I mean? And you're getting markedly different behavioral information from the different people that you see in the practice. I don't want that. How do I get my people on the same page? What does that sort of training and support of the team look like?
Yeah, I think one of the easiest places to start is to use a standardized history form, and those are available through essentially any of the textbooks that we have, the handbooks that we have for behavior problems of companion animals. They include a history form that you can use to start with in the back of that. And I think the reason I often start with one of those standardized forms is if you're just on the early side of learning how to do this, you're going to miss stuff. Of course you are, unless we have that standardized checklist to follow. And whether that's something that we're working through with the client in real time, or whether it's something that we're asking them to fill out before they come in, it's something that, for example, even when I look at a history form that for my practice is, I think it's 5 or 6 pages long by the time it spits all that data, not 6 pages of text, but looking all that, I can review that efficiently, usually in about 6 to 8 minutes, and verbalize my diagnostic plan, the additional questions that I need answered. I can verbalize that over and include, if this, then this, or if we see this, this is going to redirect them to medical, or these are the things that we can recommend from a training standpoint. So from a doctor, I could do 6 of those in an hour with a skilled training team and technician team who can implement a lot of that. Now, I say that knowing that the general practice cases, at least there are more of the straightforward cases that would apply for something like that. By the time we get to the point where they're being referred over to a veterinary behaviorist, there's probably more layers that require the clinician to be involved. But at an intake level of basically saying, is there something that we can do here before we consider referral to a veterinary behaviorist, or as a way of setting them up with the right trainer who's going to be able to coach them on the implementation of skills, knowing that if we're going down, let's say, a separation anxiety pathway versus a leash reactive dog pathway, we may have different trainers that we use based on their skill set and the actual problems that they like to work on. But we can do all of that intake efficiently in the veterinary practice.
Talk to me about the potential in telemedicine that you see. Do you think it's going to be possible that we're going to be able to have our behavior specialists in our practice, whoever that may be? I mean, are they going to be able to just do a Zoom call with this client instead of having them come in repeatedly? Is that way more limited than people think? Help me see what you see in your crystal ball.
I love telehealth for behavior, and especially when we're working with a veterinary team that does have hands-on to the limit of safety with or without sedation, but we have that team that has the ability to have that established veterinary patient-client relationship. I love coming into that conversation as a consulting specialist to say, let me ask a few of the questions that maybe you just didn't know to ask. And then let's give you some more guidance as to what we can do next and how that works. And in real time, then be able to talk through medication options, perhaps even some of the diagnostic testing that we can do to really tease out some of those differentials that might not have been ruled out yet. I love being able to do that. Truthfully, it's one of my favorite things on my schedule most days, not only from the standpoint of being able to reach patients that I otherwise wouldn't reach, but more importantly for me, if I'm working through that primary care veterinarian, part of my education is to the veterinarian themselves to try to expand their knowledge base so the next time around they can perhaps get just a little bit farther with that case before they need to reach for me. So I'm trying to onboard a more robust toolbox for them in the process of helping this single patient that's in front of them so that they don't have that same level of dependence on me for every single case that comes through.
How do you differentiate behavior and training, Chris? So I find myself using them largely interchangeably, but I feel like behavior is sort of very much in the veterinary medicine realm, and training may be a bit different. There's just huge amount of overlap there. When I think of training, I think of puppy classes at Petco, or people out in a field really working with Schutzhund dogs. Not to make it negative, but that feels different than, hey, I'm the veterinarian, let's do a behavior appointment. Those feel very different to me, but do you see them as being different? If so, how do you separate them?
The lines are blurry. That's the short answer to that question, because it's really hard sometimes to know kind of where one begins and one ends. Even we could go as far as to say that almost everything that we see is behavior, right? Movement patterns, ingestive behaviors, where the animal is looking or what they're responding to. It's all behavior. What we do about it and the tools that are in our toolbox to really tease out why behavior is showing up the way that it is, or how we're going to modify that, that's where those roles really start to differentiate themselves. Meaning, if I've got a naive puppy or a dog that is newly out of the shelter and doesn't have its basic cues of sit, come, down, stay, things like that, training is perfect for that. Those dogs don't necessarily need a behavior assessment or a veterinarian to be involved. However, when we're doing an assessment where there's a behavior change or where there's any level of suspicion that there might be an underlying medical component, and whether that's gastrointestinal sensitivity, whether that's recurrent itch issues that's creating a level of irritability, whether it's airway problems that's impacting a dog's ability to sleep restfully overnight, or whether we're looking at actually prescribing for behavioral interventions, those are all within the purview of the veterinarian and absolutely need that medical lens and that medical knowledge. The behavior modification piece kind of straddles between there, where we're saying, I've got a dog who's doing one thing or a cat who's behaving in a certain way, assuming that we've ruled out or addressed any underlying medical issues. How can I apply the science of behavior change to manage that environment, to coach the owner on how to utilize reinforcement-based training to modify that, and to build a better set of coping skills for that animal who's doing the best they can, but they might be acting in an unsafe or unproductive way. And that's where the behavior consultants and a lot of the behavior professionals come into play, not in isolation, but in my opinion, in collaboration with the veterinary team. So I don't have to coach the veterinarian on how to do all the little micromanagement of individual training or behavior modification sessions, but that I also have that veterinary team who understands what underlying medical issues may be showing up with a change in appetite or a difference in behavior or a new onset aggression or a disruption in sleep-wake cycle. That's where the differentiation really comes into play for me.
The last question I have for you, when you look into your crystal ball and you look 5 years into the future and you're thinking about artificial intelligence and you're thinking about, cloud-based practice management software and corporate consolidation, all these kinds of things, what changes do you see coming down the pipeline in the way that we engage with behavior cases?
Yeah, I think there's a couple of intersections here that are really meaningful for me. I personally don't want to give up any of my client time to AI. I really don't. I love being able to spend that time to really observe the animal, to ask the questions that I need answered, to be able to do that. And I like looking at the history data in real time and assimilating my own thoughts about what that might mean. Where I really struggle, and where a lot of my colleagues who practice behavior really struggle, is getting it all documented efficiently in a way that actually then makes a meaningful list of recommendations to clients. And that's truthfully where I use AI in my practice, is not necessarily to generate my differential lists. I'm not asking it to assess my history forms. I'm basically saying, hey, distill this down in my brain. Let me run through the education. But if there's a little recording playing in the background that can pare that down into an actionable bullet point list.
Yeah.
Oh man, I'm a happy camper.
That
cool. Is exactly what I'm looking for. So capture my words, put them on paper, and assimilate it into action items. That's where I use AI. And that's where I think, if I could wave my magic wand, getting that dialed in so that I can walk out of an hour-long appointment and just check the box and say, yep, captured it. That's where it's done,
and they've got good resources to go home with. I like it. I like where your head's at. That's wonderful. Dr. Chris Pachel, thank you so much for being here. Where can people find you online? Where can they keep up with all of the adventures that you're having?
Yeah, the easiest place to find me is on my website, which is drpachel.com. So drpachel.com. And if you go to that main landing page, there'll be links there to all of the different projects, the things we're doing at Animal Behavior Clinic, the things we're doing at Instinct Dog Behavior and Training. There's a link there to my media pages, which will take you to podcast recordings like this one, as well as any other things that I'm involved with. You can keep tabs on me there. It also takes you to my socials on the business side too. So everything is linked from drpachel.com.
Outstanding. Thanks for being here, Chris. Thanks for being here, everybody. Take care of yourselves, gang. See you later. And that's what I got. Guys, thanks for being here. Thanks to Chris Pachel for being here. Take care of yourselves, everybody. Be well. I'll talk to you later on.